So today the topic is breathing muscles and bone growth. Oh my. We're going to be talking about the 3 hidden factors behind your child's overlooked symptoms and why they need your attention now. So why are we here? We are here because there are some startling statistics lately. A recent survey showed that nearly 1 in 5 children ages 0 to 17 have a special healthcare need in the United States. That may be physical, developmental, behavioral, or emotional. And that can include some of these conditions that are seen here in red. We might see allergies, ADHD, behavior conditions, asthma, anxiety, learning disability, and developmental delays. And from where I'm sitting, from what I do and what I focus on, I have been lucky enough to see how interventions can be taken to either reverse or minimize the severity of a lot of these conditions. And that's what we're going to talk about today. It's not just about your kids, though. My services, when I work with parents, is to support parents. So another survey showed looking at how parents are feeling these days, and some of this might hit home for you. But so many parents are feeling like they don't have the chance to talk about their stress because they don't want to burden others. They wish they had somebody to help them. They don't know where to begin getting support. They could have used more support. And almost half of parents said they wish they had someone to turn to for advice and support. So what can we do? That same survey offered the suggestion. So we can equip parents and caregivers with resources to address parental stressors and connect them to crucial support services. And that is what we're going to talk about today. So my services are to support you in supporting your family. My objectives today are to bring awareness to some common developmental red flags, to set your attention on 3 overlooked drivers for these problems and teach you the common signs, symptoms indicating these issues, to empower you to take action and optimize your child's health trajectory. Let's leave that watch and wait approach behind, and to encourage you to seek out more support for you in the challenging role as a parent. If you're new to me, I am Dr. Julia. I'm coming at all of this from a dentist perspective. I practiced for a few years as a traditional dentist before I found the world of biological dentistry and further kind of developed a passion for what we call airway dentistry. And I find that I have the greatest reward in my profession when I'm able to kind of come at it from an education and prevention stance. So that's why I have this business, Auris Wellness, to offer that support. And on a personal front, this is my little family, my husband and my puppy son, Alfred. We did move from the US to Portugal and are now enjoying life in Portugal. So enough about me, let's talk about you. You might be thinking, I was told these symptoms are normal. I was told my child will grow out of it. I was told there isn't anything that we can do now. In the next 30 minutes, you'll uncover 3 key areas of your child's health to assess so you can address symptoms now before they become harder to correct. First, breathing. Arguably, oxygen is our most important nutrient. If we think about any sort of nutrient deficiencies with vitamins and minerals, you can make it years in a deficient state. Food and water, we've got weeks, days. Oxygen is a matter of minutes. And when we don't breathe right, it's going to affect our physical health, mental health, and emotional health. And I was listening to a podcast that made a great point that said where we often think about breathing as a nose to lung experience, breath is actually a body-wide event. So our posture affects how we breathe, our emotions affect how we breathe, and the result is not just oxygen going from the nose to the lungs, but really throughout the whole body, serving a lot of purposes. So when we think about who's not breathing right and some of those red flags, it might be easier to think about what we commonly attribute to being respiratory conditions, asthma or otherwise. But I'm here to tell you that snoring, mouth breathing, tooth grinding, these are all things that are indications that your child is not breathing well. And It's important to look at this now because we're going to make the analogy later of we want to treat when we're seeing smoke, not fire. And these are all kind of the embers are burning. We're seeing the smoke now. So let's pay attention. And it's not just things that we see happening in the mouth. Mind you, some of these red flags are other conditions, like I mentioned before. Specifically, ADHD has a really high overlap with something called sleep apnea. And if you haven't heard of sleep apnea, what that actually is a condition in which one stops breathing at night for a period of time during sleep, complete pause in oxygen flow. And what they've come to find is that there is a high overlap of symptoms between ADHD and sleep apnea. So when you have conditions or symptoms presenting like hyperactivity, inattentiveness, poor impulse control, mood changes, and school problems, if we address the sleep and how someone's breathing at night by sleeping, we can also potentially improve ADHD symptoms. And we also have to consider the rare situation in which if someone's been diagnosed with ADHD and there's been no evaluation of how they're sleeping, that there's a possibility of misdiagnosis there as well. So we're going to dive in to make this a little more concrete. I want to tell you about one of my clients, Sarah. Sarah first came to me. She was a known contact. She had heard that I was building a business that helped support parents in a variety of areas, but specifically she was interested in the fact that I argued that I could help their children sleep better. And the reason this is appealing is because Sarah was experiencing some tantrums at home. Nobody in the family was sleeping well at night, and it was getting to a point where everybody was exhausted. So while this seemed like a behavioral issue, I sat down with Sarah. We looked at kind of running through a greater history, and I found a lot of other red flags there. There were signs of loud breathing, snoring, tooth grinding, restless sleep. Her daughter was coming in screaming she was thirsty at night. And so I directed Sarah to go ahead and take a recording of her daughter at night during sleep. If you haven't done this yet, if you haven't even gone in to peek into your child's room at night while they're sleeping, this is one of those things that I highly recommend every parent do. You don't want to be disruptive with it, but just go in and peek at your child, because sometimes you may think that just because they're in their room from bedtime until the alarm goes off in the morning, that they're sleeping soundly, and that's not always the case. But for others, if you already know that there's maybe some of these other red flags going on, having a recording is going to be helpful. It's a helpful tool to take with you to the pediatrician, and they will take your concern more to heart when they can see visual proof of what's happening. So Sarah went to the pediatrician, and what was offered was a steroid nasal spray. They discussed the possibility of escalating to some asthma medication and looking into a possible a referral to go see an ear, nose, and throat doctor that could, down the line, result in discussions about tonsil and adenoid surgery. So I'm glad that the pediatrician was receptive to seeking out next steps, and that it was a good start as far as I'm concerned. So Sarah followed that advice. Sarah was feeling exhausted because of the way sleep was looking at home, uncertain about next steps, a bit anxious about the idea of surgery that would involve sedation, and overwhelmed about the decisions that needed to be made. So one thing that I do want to point out about what was going on in Sarah's household is that there might have been a behavioral issue, but sometimes the anxiety and kind of tantrums and behavior that goes in around bedtime can be driven from, if breathing is a struggle at night, then that creates more anxiety. And with the children not necessarily having a full understanding of the situation, they can act out in different ways. So when we moved from the consensus that this wasn't just a behavioral issue, but also a breathing issue, we kind of carried that in mind. Sarah went to the ENT, the ear, nose, and throat doctor, was told that the tonsils were big, but not so bad, didn't see a tongue tie, and the fact that she did have the recording of the snoring made them still want to pursue a sleep test. They did warn her, however, that based on the results of said sleep test, the only course of action, if it was severe enough, the results of that sleep test would be surgery to reduce the tonsil size. But there were other options. So I helped Sarah to understand the underlying problems, to identify aligned treatment solutions and professionals who could help, and I was in her corner when questions arose during her daughter's healthcare journey. After one session, Sarah told me, "Without your guidance, I would be in a complete anxiety meltdown, but now I feel hopeful there are solutions available to get things on track." Sarah did go and see the first provider I referred her to, and she said, "Thank you so much for all your guidance and referring me to provider. My daughter has been sleeping beautifully with no resistance to naps and bedtime for almost 2 weeks. She sleeps 12 hours every night without getting up. It's incredible. You literally saved us. Thank you." So I directed Sarah to another provider, and that's a whole part of how my process works. It's not always going to be a dentist that has the solution to the issue, and it takes sometimes several providers to kind of unwind what's going on. Our bodies are very complex, and we need a team to really be able to get best results. Bigger lasting changes are typically a marathon, not a sprint. I know that nobody wants to hear that. Everybody wants a quick fix these days, but the reality is the sooner we embrace this and get moving on assembling the right care team and getting the right advice and treatment, the sooner we see better health for your family. And that's going to bring us to point number 2, souls. So pop quiz. If you are sitting at your computer tuning in right now live, I just want you to take a moment and see, is your tongue up resting on the roof of your mouth? This is a strange question for you. You're not alone. I was already well through dental school and a few years out before someone asked me this for the first time. I had no awareness of where my tongue was or where it was supposed to be. And our tongue is supposed to be resting gently at the roof of our mouth. And that's something that we're going to talk more. So we really do want a proper balance of the way that the muscles in our cheeks, lips, tongue, face, all the muscles in the face work together. And that's in order to coordinate properly activities like breathing, chewing, swallowing, and talking. And when things are working correctly, it helps the face grow properly, it makes digestion easier, and it keeps the airways clear for better breathing. I'm going to show you this quick video because the tongue is just an underappreciated muscle. The tongue too, you can see there are other muscles moving in the throat as well. Sarah's daughter did ultimately start doing some exercises, being a professional who could guide her in doing the right exercises to get the muscles in and around her mouth working different. So we think about working out all the other muscles in our body, but the muscles in our face deserve some credit too. Mewing's getting a lot of hype these days, and mewing is one example of doing the kinds of oral exercises and getting the tongue posture right. So there are a variety of reasons why our tongue posture might not be right. Some of it is due to just weak muscles, poor coordination. Some of it is due to actual anatomic structures. In the case of Sarah's daughter, as she started to make some progress with the exercises, it became clear that even though the ear, nose, and throat doctor had mentioned before he didn't see a tongue tie, there was in fact something called a tongue tie present. And we can dive in if you have more questions later to talk about tongue ties. It's a complicated matter, but just suffice to know that that was a diagnosis that came into play for Sarah's daughter. So just from doing the exercises alone, we still saw some benefits. Sarah's daughter stopped snoring, which was huge. The dentist she was seeing reported that her jaws were growing better, which was great. But as she was working through those exercises, it became clear that she was still a bit limited by that time. So they did decide to go ahead and do some treatment because some problems were remaining. Not only was her tongue limited, but we were seeing enlarged tonsils. So our body is magnificently designed for nasal breathing. Breathing through the nose filters the air, warms the air, humidifies the air, and there are a lot of benefits also with creation of other things like nitric oxide that have other benefits through the body that are produced when we breathe through our nose. We lose all of those benefits when we're breathing through our. And the filtration aspect is important because if our nose isn't being used to capture dust particles, environmental toxins, other things, that burden becomes part of what our throat ends up having to do. And that's where it can lead to irritation of the tonsils and growth of the tonsils. And that is what was happening for Sarah's daughter. After the tongue tie release, allowing her daughter to make more progress with these oral exercises. Simply within 1 week of the procedure she had done, her tonsil size reduced dramatically. So that was a huge win for this family. And what Sarah says now is this, and this is why I've created a new program with more ongoings. You'll see. Sarah told me, when no other doctor could even identify a solution or diagnose the problem, Dr. Julia empowered me to fully understand and address the actual root causes of my oldest child's wide range of sleep, breathing, and behavioral challenges stemming from her airway health needs. I could not have asked for or even known it was possible to have such a supportive and expert partner and educator by my side throughout this journey. In comparison, all our daughter's pediatrician knew to do was to prescribe a serious drug for asthma, which is a condition she did not have. It is because of Dr. Julia and the Airway Health team she connected us with that my oldest daughter now sleeps through the night and is on the way to successfully resolving sleep issues, oral motor function challenges. Dr. Julia is a true parent advocate. Every parent who has a child facing sleep and airway issues must have Dr. Julia in their corner. I could not have done this without her. You can see how incredibly rewarding it is for me to be able to be guiding a client more than just one session. If we had just stopped after 1 or 2 sessions, that feedback was great. We had some great quick wins there too. But this is why I'm doing what I'm doing now. And I'll tell you a little bit more about that still to come. So looking backward, if you are tuned in live for this call, you're going to receive an email with a bonus video that dives into problem origins. If you're sitting there thinking like, but why is all of this? Why aren't we using our tongue and our muscles in the way we should? Just you wait, you'll find out more soon. But looking forward, we know that early intervention can improve speech difficulties as well as seemingly unrelated digestive problems, ear infections, and even cavities. Taking action early might eliminate the need for costly and complicated interventions like surgery or medications in the future. So drop a heart in the chat if you think you might support or you might value having some support like Sarah had. All right, that brings us to number 3, bone. As you're starting to gather, they're all a little bit connected. So the mouth is a mirror to the health of the rest of the bone. Malocclusion is a term for when the teeth or jaws aren't lining up in the ideal specific way that they were designed to. So when a dentist is looking and noticing that, we talk about an upper jaw and we talk about a lower jaw. And the upper jaw is called the maxilla bone. That's this orange bone that you see highlighted here. It's not just connected to the teeth. It's connected to the nose. It's connected to the eye. So there are going to be other symptoms that are going to be related to how this bone grows and develops. And we have to think about this too, that no body system exists in isolation. You don't just have the bones growing. You have also the muscles that are directly influencing them. And it really is that kind of a relationship because form follows function to a certain extent. We know that the muscles and the forces that they provide actually guide the growth of the bones. So our tongue that I mentioned before should be resting in the roof of our mouth. That is one of the ways when our tongue is resting on the roof of the mouth that we get a nice broad development of the upper jawbone, and even kind of allows for, during swallowing, the right forces to drive the forward growth of the face as well. And it's so critical because when we think about it this way, the roof of the mouth is the floor of the nose. So when we don't develop the jaws correctly, we're not developing the nose correctly. And that goes back to point number one, we're not going to be breathing correctly. So breathing, muscles, and bone growth, they are all interconnected here. And hopefully you're starting to see. In some cases, a dentist may be the first person to alert you to a growth and development issue, because we have this view at bone growth that others don't necessarily have. In other cases, if your dentist tells you you better start saving money now for braces, you need to know that a problem already exists now. So why are we going to wait and watch it get worse? Is what the mouth of a thumbsucker looks like. So a thumbsucker who kind of couldn't get rid of that habit in a time. This child is at least 6 years of age. As we can see, some adult teeth are already present. So they were sucking their thumb well past the rim. But that put forces. It wasn't just the muscles in and around the mouth. The thumb itself was providing an additional unwanted force into the roof of the mouth, pushing up into that nose space, kind of resulting in undesirable forces and a narrow upper jaw bone. So we can see that that's narrow. The teeth up here are left with an open space where they shouldn't have that open space. And what's happening back here is what's actually called a dental crossbite. These upper teeth should be sitting on the outside of the bottom teeth, more like this position. But in this case, things got crunched together in a poor position, and now they're stuck like that while this child is still. That same situation is happening down here a little bit. These teeth are in crossbite. Something went wrong in the growth pattern, and now that needs to be addressed. This child isn't 6 yet. They're younger than 6, and we have this problem, and we have the eyes on the fact that something needs to be done now because growth is not on track. And this child, it looks a little different. I don't see a crossbite like I was just talking about before, but one of the things that is happening, and we'll kind of get a little bit better view of that in a moment, but the upper teeth are completely blocking out the lower teeth. And that's another red flag sign that the teeth and the jaws aren't growing or relating like they should. We need a certain amount of the lower teeth showing with the upper teeth when the teeth come together. So sometimes it's just as simple as having a trained eye looking at these teeth telling you that something's not on track. Other times, we don't even need to look at the teeth. We can look at the child's face and see that things are not on track. This one's a little harder. You really do need to have a trained eye for this one, but I'm going to show you. This is what this child's teeth look. And once you see her teeth, you can sort of see how the lower jaw is stuck almost like a bulldog. The bottom teeth are sitting in front of the top teeth, and she's starting to get sort of that look of a bulldog. So that's one situation that can arise. Then we can have the opposite situation, where in some cases, this child has almost no lower jaw, which is hard to appreciate, again, if you don't know what to look for. This photo is what we have after treatment's been completed, and now she's got a beautiful balance between an upper jaw and a lower jaw. Here, she just had an upper jaw that was sticking out and lower jaw that was sticking back by comparison. When I talk about this, it's not because I enjoy picking apart the cosmetic details of children. It is really a reflection of overall health. And when we can get growth on track better for these children, they're going to develop in a way that looks healthier because they are feeling healthier. So that's what this is all about. So one more example, in this scenario, you can see better where the top teeth and the bottom teeth shouldn't be completely overlapped. So in this situation, you might be like, but what's wrong here? This kid has great teeth. So I'm going to tell you just about Jack's daughter. This is Jack's daughter's mouth. And Jack's daughter was dealing with some allergies, some hyperactivity issues, and without necessarily realizing, they fell into chatting with me. And I pointed out that the baby teeth, while this might look like a nice smile, the baby teeth are actually meant to have spaces between them because the baby teeth are going to be smaller than the adult teeth that eventually emerge to replace them. So when we see teeth that are lined up like this in a child's mouth and they are all primary baby teeth, we have to start asking ourselves, is growth not on track here either? And so Jack took that into consideration. We went back and found a photo of Jack. Jack had never needed braces, and Jack had beautiful spaces between his teeth. So Jack was willing to admit, maybe we do need to do something now. And after coming to a conclusion, we picked a treatment philosophy that felt right for his family, and they went with a dental appliance, a dental expander. The way that this expander works, this purple sparkly object down here, is it starts with the two sides of the expander in kind of adjacent position, and there's a little key that gradually over time adds some force to push out on the roof of the mouth, and it provides that force that we didn't get naturally from optimally function of the muscles. So in this case, it's an intervention to get the growth back on track. So again, we've got Jack's daughter at the beginning, Jack's daughter during treatment, all of this extra space was created, and now you can see Jack's daughter's mouth has great space. As a side benefit, a lot of those food sensitivities and allergies resolved, and behavior and school performance was improved. So remember, we might not have extreme medical conditions that we're dealing with, but when we see that something's not on track, we want to deal with it when we see smoke and fire. So some of those signs of smoke, that's the red flag checklist that you received before logging onto this call. And hopefully you've had a chance to look at it. If you're seeing 3 or more of these apply to your family, then I'd love to set up a call with you and talk. But these are the smoke signs we're looking for. Some of the more common ones, there are of course others. But if we see these signs, we can come to the conclusion that something isn't working right with either breathing, muscles, or bone growth. And when those go unchecked, so when we talked about that sleep apnea condition earlier on, these are all the types of things that are associated with sleep apnea in an adult. So if nothing gets changed and the condition stays the same or gets worse, then we're looking at hypertension, cardiovascular disease, stroke, diabetes, obesity, chronic pain, reflux disease, lowered immunity, depression, anxiety, memory issues, daytime sleepiness, and accidents. All of these are increased risks from having a condition called it. So by now, hopefully you've kind of got the idea that this all goes hand in hand. We have better muscle function, driving better growth, and better breathing. But it can also happen in a variety of ways. You could simply get a cold one day, and then all of a sudden you have a new habit of breathing with your mouth open. That may not have been already driven by poor breathing or poor sleep before, but now that's going to add into this circle. And when we talk about better overall health that all of these are combining into, I just want to take a brief moment to highlight what that might mean. So Airway Dentistry can actually improve your child's overall well-being by improving focus and grades in school, helping your child manage their emotions better, helping to support body growth and posture, improving speech and communication skills, boosting friendships and social skills, boosting confidence and self-esteem, strengthening the immune system and the microbiome, lowering the risk of ongoing health issues, and reducing the need for long-term medications. So what have we learned today? Some of the signs and symptoms of an airway health problem, how your child's teeth may in their own be a red flag, how improving oral health can affect the rest of the body, that you don't have to wait and watch it get worse, and that you're not alone and you do deserve support.